A pleasant day to everyone. I am your nursing student Mick, and for our health teaching today, we'll be talking about the dangers of smoking cigarettes with the title Clearing Out the Air. At the end of the lesson, we will be able to know what is smoking, what makes smoking cigarettes dangerous, how does it affect our body, and how do we stop ourselves from smoking. First, let us define smoking. It is the act of inhaling and exhaling the fumes of a burning plant material. Said plant materials can either be marijuana, tobacco, or hashish. Tobacco contains nicotine, an alkaloid that is addictive and can have both stimulating and tranquilizing psychoactive effects on our brain. So, smoking cigarettes either stimulate or relax our brain. What makes smoking cigarettes dangerous? It's because of its three components, namely carcinogens, toxic heavy metals, and poison. What were the three compounds mentioned earlier? First is carcinogens, which are any substance that can cause or aggravate cancer. Second one are heavy metals, which are metals and metal compounds that have the potential to harm our health when absorbed or inhaled. Third one is poison, which are any substance that, when introduced to a living organism, can cause severe physical distress or death. What are examples of carcinogens? First is benzene, which are found in pesticides and gasoline, and are found in high levels in cigarettes. Second one is formaldehyde, which if it is in liquid form, it is used to preserve dead bodies, and if it is in gaseous form, it is responsible for some of the nose, throat, and eye irritation smokers experience when breathing in cigarette smoke. The third one is vinyl chloride, for examples, which is used to make plastics, and that smokers are exposed to it through the cigarette filters. And also in studies, it is found that 70% of cigarette components cause cancer. Second one are heavy metals. For examples, we have arsenic, which is used for rat poisoning in the pesticides for tobacco farming also. And second one is cadmium, which is found in batteries. Last one is poison, which is contains about 250 poisonous gas in each cigarette smoke. We have three examples, which are ammonia, which is used in cleaning products and fertilizers, and boosts the impact of nicotine on manufactured cigarettes. Second is carbon monoxide, which is found in car exhaust, and that cigarette smokes can contain high levels of carbon monoxide. Third one is nicotine, which is used in pesticides and is the addictive element in cigarettes because it causes, as we have said earlier, it causes either tranquilizing effects or relaxing effects and then stimulating effects. How does smoking affect our body? Let us look into Filipino statistics, which says that about 110,000 Filipinos die from tobacco-related diseases each year, and about 21.8% of male deaths and 9.7% of female deaths are caused by tobacco smoking, forming an 18.6 percentage overall. It increases the risk of cancers, particularly in the cancers of the mouth, throat, bladder, and kidneys. It is also said in that study that smokers spend 25% more time in the hospital than non-smokers and are twice as likely to die before age 65 and may lose up to 20 minutes of life every day for every cigarette they smoke. Let us look into how cigarette affects each organ system we have in the body. First is the brain or the nervous system. It causes mood stimulation, anxiety, and irritability, addiction, and dependence because it may temporarily put you in a good mood, but dependence is common. Withdrawal side effects like anxiety and irritability, and gradually the person will be addicted and dependent on the cigarette. On the head, it causes a smelly hair because tobacco smoke sticks to the clothes and hair for a long time, and poor vision because it increases the risk of glaucoma, which is the increase of intraocular pressure in our eyes, macular degeneration, and cataracts. On the nose, it causes irritation to the whole upper airway because of its content of ammonia and formaldehyde that triggers the production or overproduction of mucus in our sinuses. It also increases the risk of chronic sinusitis and has negative effects on senses, as smoking can lead to a decreased sense of taste and of smell. Also, cancer, as prolonged exposure to smoking has been linked to nose and sinus cancers. On the respiratory system, particularly on the lungs and airway, it can cause bronchitis, tuberculosis, pneumonia, persistent coughing, COPD, or chronic obstructive pulmonary diseases that 8 out of 10 causes of COPD are due to smoking. It can also worsen asthma symptoms, and of course, it can cause lung cancer. On the heart, or our cardiovascular system, it may pose risk to heart disease, high cholesterol because it lowers our HDL or good cholesterol, and it increases our LDL or bad cholesterol. It constricts the blood vessels because of its nicotine content that can lead to stroke and heart attack. Also causes blood clotting. Smoking causes clotting throughout the body that may lead to heart attack. It also increases the risk of blood cancer, that smokers have higher risk for blood cancers such as leukemia. On the reproductive system, it may cause problems to pregnancy and newborn such as asthma, growth problems, and infections. It can also heighten the risk of acquiring cervical cancer, and it may cause erectile dysfunction in men as an erection requires a lot of blood flow to the area, while the nicotine content of cigarettes constricts our blood vessels, preventing the flow or rapid flow of blood. On the immune system, smoking lowers the immune system's ability to fight off infection, especially in the respiratory tract. On the integumentary system or on our skin, hair, or nails, there are various skin changes caused by smoking such as yellowing of the fingers, facial wrinkles, lines around the lips, and baggy eyelids. It can also cause the squamous cell carcinoma or cancers, hair loss, balding, or graying of the hair, and wrinkly skin is, as explained, because of the substances in the cigarettes that cause dry skin and premature aging, and also because of nicotine that reduces the blood flow to our skin. Digestive system. Our digestive system is affected by smoking, that it is exposed to higher risk of acquiring diseases like pancreatic cancer, mouth cancer, insulin resistance, and higher risk to type 2 diabetes. Secondhand smoke. So we have now finished discussing the different effects of smoking on the different organ systems of our body. Now let's go to the outside environment, which is its effect on secondhand smoking, because a mix of smoke from a burning cigarette, pipe, or cigar plus the smoke exhaled by the person smoking. This smoke is harmful to the health of both smokers and non-smokers, including children. So not only does the smoker endanger his or her own health, but also endangers the health of the people around him or her, like his family and friends and neighbors. Third-hand smoke is the residual nicotine content of or other chemicals left on indoor surfaces by tobacco smoke. It is spread to other people by them touching contaminated surfaces or breathing in the off-gassing from these substances. Because it clings to clothes, furniture, drapes, walls, beddings, carpets, dust, vehicles, and other surfaces long after smoking has stopped. So if secondhand smoking is about another person inhaling the smoke of a cigarette, third-hand smoking is about when the smoke has attached or clings itself on inanimate objects such as clothes and a person touches it and the hand comes in contact with his eyes, nose, or mouth. It can also cause bad effects. For now, we have tackled what is the definition of smoking, why is it dangerous to our health and everyone around us, and also its effects. So that will be all for part 1. Please stay tuned for part 2. Thank you.